Hello, everyone, and thank you so much for joining us for another Hits Different talk today. We are so excited to be going live with one of our very special Focus on Diabetes champions, Patricia Welter, today for American Diabetes Month. This year's theme is Today's Diabetes Hits Different. So we're so excited to have you joining us today to follow along on Patricia's journey and learn how diabetes hits different for her. My name is Abby Bornemeyer, and I'm the social media and digital events manager here at the American Diabetes Association. And without further ado, I am going to turn it over to Patricia to introduce herself. Hello, Patricia. Welcome.
Hello, everybody. Hello, Abby. This is such an honor and a privilege to be with you today. And I am Patricia Welter, a longtime type 1 insulin dependent diabetic that has also had complications from diabetes, which I'm sure we'll talk about today, including diabetic retinopathy. So I'm thrilled to be here, Abby.
Thank you so much for joining us. We really appreciate it. And, we're really excited to just learn more about your journey and how diabetes hits different for you. If you're tuning in right now, let us know in the comments where you're tuning in from. And if you have any questions too for Patricia as we go along, put them in the comments and we'll try to get to as many of them as we can. We want this to be a conversational event and hopefully that you'll take something away from this. So, to kick this off, the first question I have for you, Patricia, is, what was your diagnosis like, and what was going through your mind when you were first diagnosed with type 1 diabetes?
Well, I had symptoms from a very, very early age, as early as 3 and 4. However, I was not officially diagnosed until I was 14. And my mother was a diabetic, and my dad's brother was a diabetic. And they kind of felt it was a death sentence, which scared me a lot as a teenager. And I felt rather hopeless. I felt that I could not control my life. And my parents' kind of outlook, as much as they loved me and I loved them, made me feel like I really did have something that I would not be able to live through.
Wow, that's so hard to hear that too. And, from your parents' perspective as well, having a child being diagnosed with type 1, I mean, I'm sure they did feel like, what was going to happen. They were probably very worried about, what was going to be going on for your life and, how they could support you the best that they could and everything with living with that disease. But you are here to talk about it today, and think you're doing really well with managing your diabetes today. So that brings me to my next question, Patricia. What are some physical and mental challenges that you've faced over the years as a result of your diabetes?
One is first the stigma of having diabetes at age 14. And it was hard for me to learn to give myself insulin shots, which sounds very easy to me now. But to be able to go to school and be on my own without a parent being there all the time, I had to learn how to give insulin injections. And I used to go hide in the bathroom, because I was ashamed of being a diabetic. I had to get special permissions to bring treats to school to hit, for low blood sugar times. Sometimes teachers did not understand. And then as I grew older, I realized there was a lack of spontaneity in my life. And I don't know that people appreciate that they can just go anywhere and do anything anytime they want, but I always have to plan for it. I've also unfortunately had diabetic retinopathy, which has ended up in the loss of my left eye. And I had 3 surgeries back in the early 2000s to try and save my eye. And under the third surgery, I had a stroke due to too much anesthesia. So I ended up having a stroke. And when I awoke a week later from the episode, I was left side paralyzed. And at the time, and currently, I'm in the fitness industry, the Pilates industry specifically. And to be left side paralyzed and to go through things like having aphasia and having to relearn to speak and cue fitness exercise, Pilates exercise, and learn to move my left side has been an issue. I also have had issues getting insulin throughout the years, getting insurance to approve my insulins. Sometimes there's been denial, and I've had to fight to be able to take the insulin. There's a cost factor as well, a cost factor of test strips. And there's, been roadblocks for me throughout the years. I consider myself pretty tenacious, and every now and then it does get a little tough to considerably always having roadblocks in your way. I recently also got diagnosed with high blood pressure, which I'd pretty much stayed off of having that issue, which also threw another little roadblock, getting used to a low dose of blood pressure medication. And sometimes it just takes the fun and the spontaneity out of certain days of my life.
Well, thank you for sharing a little bit about, the physical challenges that you've experienced over the years. And I mean, they do tie into mental challenges as well. So, like you mentioned, you have to plan every time you want to go somewhere. You have to make sure you have enough insulin or, snacks for if you go low, things like that with you. So it is a lot. It's hard. And I'm sure it's hard for you, to feel comfortable to always go somewhere like that because you're like, I have to take this with me or that. Will there be, will this be available to me there? So, I mean, thank you for sharing that and, being open about that as well. And along with, your diabetic retinopathy journey and now that you have high blood pressure. So there's all different things now that you have experienced as a result of your diabetes. But now, how would you say that you manage your mental health amongst all of these different challenges that you've faced and continue to face?
Well, there's several factors here. One is, it sounds silly, but managing your blood sugar levels. As blood sugar levels go high or low, my mood will change as any other diabetic. So trying to keep them into a certain level. And sometimes you get even more frustrated. So the blood sugar management becomes harder because you get nervous or excited about it. Number two is there's going to be days where it's just tougher to get up. As a diabetic, I found that my energy level just isn't at best in the mornings, and I have to work to get it. Number two is sometimes you just have to talk to somebody and get help or counseling or talk to people. It's been great that I found a community here in the American Diabetes Association. Sometimes you think you're just the only one, or you're just the only person that is suffering with these things. I feel it's important to get proper treatment from your physicians and mention the fact that you're having a problem with, your mental attitude. I like to take long walks, and for some reason, every time I take a walk, everything seems just a little brighter. I also teach exercise as a living, and I've done that for the past 30 years. And exercise in any form, it doesn't matter what you do. It could be Pilates, which is what I teach, or fitness, or yoga, or Tai Chi, or Qigong, or just walking or swimming. It doesn't matter what you do, but exercise is going to give you, and it's been proven to give a better mental attitude. Having a supportive partner, my husband, Bob, has just been phenomenal in getting me through so much, as well as a very close-knit circle of friends and supporters that help me get through those days. I know that after I suffered the stroke and the loss of an eye, I felt really sorry for myself. And I would say I did turn to the couch because I wasn't able to move on the left side for a little while. And they did an intervention to get me up and out. And my husband, well, then he was just my fiance. He started taking me dancing, having my dance instructor drag me around the floor. He took me around Disney and made me hobble around the floor. And so that was something that happened. And I think having a supportive network of friends is so important, and seeking medical treatment for issues, maybe you need to talk to a medical professional.
Absolutely. I agree with everything that you just said. And I think that everyone here tuning in also can relate to those different things too. And you gave great tips for managing your mental health. It's a lot living with diabetes, and you have to have that support system, those people there that you can turn to when you're having a bad day, or you just need to talk to someone. You need to share your feelings. It's so hard to keep those feelings bottled up inside, because then you feel like there's no hope. Then be able to use your voice and talk to other people and have that support system. So here at the American Diabetes Association, we are here to support all of you as well. We're a whole community, so reach out, whether it's messaging us on social media, or submitting a blog at diabetes.org/blog. Share your story with us. We're always here to listen to it, and we'd also love to give you the opportunity to share your story on one of these live events as well. So I think that's so important, especially in today's world, just sharing your story and being open about the things that you are going through as a way to manage your mental health. And also through exercise, like you had mentioned. It's all about, it's not a race or a competition. You don't have to do those crazy things, or like a marathon, to be able to be involved with exercise, but just finding something that works for you and your body, and that you enjoy, because it should be fun, and that should be an outlet for you to manage your mental health as well. So that's really cool, Patricia, that you're a Pilates instructor and you're so passionate about it too, and teaching other people about it, which is awesome.
Well, thank you. And again, I think what you said is key. It has to be something you like to do.
Right.
And there's so many forms of activity. And I will say also, I want to reiterate, the American Diabetes Association, since I've been involved, has just been such a resource of support and information and place to go. And I feel so akin to the community, the diabetes community that you offer. And I want to thank you so much for that.
Oh, thank you. Well, we appreciate having you as part of our community, and you always advocating for us as well, and, sharing our resources, and, being our voice too. So it's a team effort. We appreciate you though too. So, Patricia, you've been living with type 1 now for many years. I'm sure you've experienced many changes over those years. Would you be able to talk about some of those changes that you've experienced?
Absolutely. When I was first diagnosed, my mother was diabetic at the time, and a very early version of a glucose meter. I was kind of afraid of it, I'll be honest. So it wasn't until I actually accepted the fact I needed a glucose meter and went with that I could start to see, oh my goodness, I need to manage this more. I also feel like then through the years, I used to have to take insulin injections with a needle and a vial, which are very cumbersome to carry around. So when they introduced insulin pens, oh my gosh, that was a whole set of new freedom. When I moved to Florida 30 years ago from Hawaii, the healthcare is a big part of this area, and I was able to find a great endocrinologist. I didn't even know endocrinologist existed. I just saw my primary first. I found a great ophthalmologist. I found a wonderful registered dietitian as part of a hospital program. I found a diabetes management program. I found great resources. I joined a diabetes support group, and I assembled a great team through careful research that could help me in managing my diabetes much better. It made a world of difference. And that was all on the positive side. Then on the other side of things, as I said, roadblocks continue to happen. I experienced retinal bleeds and eventually had a retinal detachment. I found a better retinal doctor. I found a retinal doctor that actually is still with me today, that performs surgeries and he did laser surgeries and able to keep my right eye as being able to see. And when I suffered the loss of the left eye and the stroke, my then boyfriend, Bob, was there for me. And it's amazing to find a man that would stick with a woman, even though she was lost an eye and had a stroke. And he encouraged me to run a Disney half marathon with him. And 6 months after the stroke and the loss of the eye, and he helped to hold my hand the entire way through and helped pull me across the finish line. At that moment, I realized that I can help manage my own diabetes. I can master it. It doesn't master me. And from there on, I went on. At the time, I owned a Pilates studio. Until recently, I owned it. And I became a Balanced Body Pilates master instructor, where I teach teachers from all over the world how to teach Pilates. And that, just becoming that was phenomenal for me. But all of the advances in medicine today and all the advances in meters and pumps and everything has been just a world-changing event, and bringing awareness, as the American Diabetes Association does, to diabetes and the proliferation, and helping to fight the affordability of insulin and medical supplies. That has also been a game changer.
Wow. You sure have experienced a lot of changes, Patricia, over the years. But like you mentioned too, all the advancements, the resources and everything, that just, it goes a long way. And, we're going to continue to evolve, and hopefully, things will become better, not necessarily easier, but, just better in the long term for those living with diabetes. But yeah, that's all great information that you just shared. And I love too how you shared about your moment that you realized when your diabetes hit different at the Disney half marathon, which is that's so inspirational. That's amazing.
Well, thank you.
Yeah, absolutely. So, Patricia, I'm sure people who are tuning in would love some advice from you too. So, is there any advice that you could give, someone maybe who's newly diagnosed with type 1 diabetes, or the parents of, a child who is newly diagnosed?
Okay, I'll start with the child being newly diagnosed. It is so important to get the proper treatment immediately, because if you get early diagnosis, early treatment, and follow a tailored regimen for you, you can manage diabetes so much better. I wish I had known this, when I was diagnosed. I wish my parents had, they tried, but it wasn't as, the availability of management wasn't what it is today. So parents, know that your child can live a full, healthy, full, fulfilling life if you do help your child to manage. I know a lot of children resist the treatment, but you will get past that. And it's important for your child to buy into the whole program and be a part of their own management. As far as other people that are just newly diagnosed, again, early diagnosis, early treatment. And I want to say too, keep your annual eye appointments, because that can detect early changes in your eye. And the retina specialist that I see now, or have seen the last 20 years, said that I didn't need to have lost my left eye. With the advances they have today, if you get early treatment in eye disease, you can prevent losing your vision. And that's the same for managing all components. If you get early treatment, early diagnosis, and you are able to follow a regimen, and I will say there is a component too of eating properly, but still with insulin, you can manage to eat, things that you want. I feel that I can't say enough: early diagnosis, early treatment, and proper treatment and proper care. And also, I know that not everyone has accessibility to finding a proper healthcare team, but finding a great endocrinologist or a great primary care that can help you manage. Finding there are resources out there where you can get a diabetes management course, whether you're a child or you're adult. That is key. If you are able to get a referral to help with a registered dietitian to help you understand how eating goes along with either oral medication if you're a type 2 or just managing it. I know sometimes if you're a type 2, just having the proper diet, losing some weight will help you control your blood pressure, will help you control the management and reduce your amount of complications.
Wow, thank you, Patricia. Those were great points that you mentioned. Great advice for anyone who's listening. You know, I mean, so many important factors. I really like how you mentioned that, parents should include their children in their diabetes management routine because, I mean, if they're just managing it for them, they're not really learning how to live with it themselves. So I think that's super important. And just, when you notice something's wrong or a little off with your body too, just going in instead of putting it off, because there are a lot of times that these things can be prevented, like complications, such as your diabetic retinopathy. Possibly if you go in for those annual, dilated eye exams, which are so important. But if you notice something's off with your body or you're experiencing like the symptoms of diabetes, definitely go in and say something to your doctor. And then, they can help you to find that, diabetes care team for you that will help you throughout the process if you do end up having diabetes. So you're not alone if if you're experiencing those symptoms or you end up getting diagnosed. There are people, like we mentioned, here to support you. So great points. Thank you, Patricia, for those.
Absolutely.
So, as we're about to wrap up here, are there any final words that you'd like to share with everyone who's tuning in today or for American Diabetes Month?
Well, I was blown away by what the American Diabetes Association has been doing to bring awareness this month. And if you didn't see the feed yesterday of where diabetes is around the world and all the statistics, it's mind-blowing. I do want to say that I don't know if everybody does realize what a resource the American Diabetes Association is. If you go to the website at diabetes.org, you can find a plethora of information on diabetes resources and information that has just been, that was a game changer for me. And I, as you have said, Abby, turn to the American Diabetes Association, contact them. It is amazing what you all have been able to do. I'm also want to bring awareness to the accessibility and affordability of medications to treat diabetes, because that is an ongoing passion of mine, because not everyone has accessibility and is able to afford the cost. So continue to support in the fight to bring that to the world population.
Thank you, Patricia. Also, too, as we wrap up, I'm sure you're inspiring a lot of people, just like me, all the people who are tuning in right now. But if people would like to follow along on your diabetes journey and your life journey in general, where can they follow you?
I have an Instagram account. It's the ADA for American Diabetes Association Warrior. So Apple Dog Apple Warrior. That's one Instagram account. I also have a Facebook account that's open to the public at patricia.welter, Welter. I have another Instagram account, but the main one is the ADA Diabetes Warrior. I would love to hear from you all out there, because I would love to hear what you have to say.
That's great. Well, thank you. And, that's always just so positive to be able to have someone too who's, saying you can reach out to them. And Patricia's always here to listen to you all if you have, you want to share your story with someone else who's living with type 1 or just, want to talk about what it's like living with diabetes. That's great that you're willing to connect with people and talk because we are all one community.
That's right. That's right.
Well, this has been wonderful, and thank you all for joining us on your Tuesday for this special Hits Different talk for American Diabetes Month. I hope you've been inspired, and it's been great to be able to connect with you, Patricia, during this time too, and just talk really about the changes that you've seen in diabetes over the years as well. And for those of you tuning in to learn more about, this month's campaign and the different activations that we're doing, I highly encourage that you visit diabetes.org/hitsdifferent. There's a lot of information on there and a lot of different ways that you can still get involved with it this month. So thank you all so much. And Patricia will have to do, another part 2 sometime soon.
Would love to. I would love to. Thank you for the honor and the pleasure. And for all of you out there that have tuned in, thank you so much.
Awesome. Well, thank you, everyone. And I hope you have a great rest of your Tuesday.
Bye-bye.